When you first start using the hip hook or the ball, you may notice that it's quite intense. If you've had this muscle that has been tight, probably for decades, it's likely that it's not going to feel too great to be poked at, especially since it's probably never been touched before. So my suggestion is to give yourself an opportunity to ease into it. There's no rush. This muscle has been tight for a very long time. It'll be more effective if you allow your body to slowly ease into the sensation of having this pressure on your iliacus and psoas. So whether you're using the hip hook or the ball, it applies to both. I'm going to give you little tips that will help you just to ease into that pressure. One simple thing is that if you have purchased the hip hook and it's a little bit too painful or a little bit too sore, is really to warm up the area with a ball. You use the ball first and spend some time releasing the pressure there. And then after maybe a minute or so going to the hip hook, then some of that tension will have released and it'll be a little bit easier. Similarly, when you're on the hip hook, you can choose not to put all of your pressure on it. So if I'm rolling onto it, you can see how my knee's a little bit bent. I'm using my knee to kind of support the amount of pressure that I'm putting on it. And I'm just putting a little bit at a time and gradually rolling my body closer and closer to the ground. So you can modulate how much pressure you're putting by using that technique. Similarly, if you take your leg out to the side and then put pressure on it after you have your leg out to the side, that will help take some of the pressure off as well. If you're laying completely flat, that's less pressure. If you're up on your elbows, it's obviously more pressure. So these are all things that you can play around with. And last but not least, for the ball or the hip hook, you can use a small towel to place over the tip and then position yourself using that too. That helps kind of take away some of that intensity of the pressure of the ball. Because, you know, this tool is designed to provide a very pinpoint amount of pressure, which is replicating what a skilled physical therapist or other practitioner would place on that muscle to really achieve the most effective release. But you may need to ease into that, and using a more diffuse pressure like this, or less pressure overall, or using a towel will help you get into that place, that magic place that you're looking for.